Have you ever wondered about the state of your hearing, or perhaps noticed subtle changes? Just like a regular checkup for your physical health, understanding your hearing is a crucial part of overall well-being. A complete hearing test is a comprehensive examination performed by an audiologist to thoroughly evaluate your auditory system. It is not just about hearing sounds, it is about understanding how well you process them and determining any potential issues. This thorough process begins with a detailed medical history where the audiologist will ask about your general health, any medications you take, and specific concerns you have about your hearing. This initial conversation helps them understand potential contributing factors and tailor the examination to your needs. Following this, a visual inspection of your outer ear and ear canal, called an otoscopy, is performed using a special light. This checks for blockages like earwax or any other visible abnormalities that might affect your hearing or test results. The core of the test often involves pure tone audiometry, conducted in a soundproof booth to ensure accurate results. Here, you will listen to a series of tones at different frequencies and volumes through headphones. You indicate when you hear a sound, allowing the audiologist to map your hearing thresholds for both air conduction, which measures how sound travels through your outer and middle ear, and bone conduction, which assesses the inner ear directly by vibrating the skull. This distinguishes between conductive and sensorineural hearing loss. Another vital component is speech audiometry, which evaluates your ability to hear and understand speech. This can include speech reception threshold testing, determining the softest level at which you can hear speech, and word recognition testing, assessing how clearly you understand words at a comfortable listening level. Sometimes, speech and noise testing is also performed to simulate real-world listening challenges, providing a more complete picture of your communicative abilities. The complete hearing test provides a detailed audiogram, which is a visual representation of your hearing levels across different frequencies. It helps pinpoint specific areas of difficulty and guides the audiologist in making personalized recommendations, whether that involves monitoring, protective measures, or exploring hearing solutions like hearing aids. Understanding these steps empowers you to actively participate in your hearing health journey, ensuring you receive the best possible care for your unique needs and maintain your connection to the sounds of life.